Good morning, my name is Jennifer Collado Rivera. Today I will make my presentation for the class Design Online Course Materials. The theme of my presentation is about the new diabetes treatment using stem cells. This is the outline for the presentation. First of all, I will give an introduction for the topic. I will explain what is diabetes, how diabetes is treated, type of diabetes, the different treatment, and the new treatment using the stem cells. After that, I will conclude with my presentation and I will give my opinion as a biologist student and I will show the reference. The objectives for this presentation are explain what is diabetes, create an awareness of the increase in alarming statistic of insulin demand, and explain the treatment of diabetes and how the new discovery can contribute to help the patients. What is diabetes? Diabetes is a condition where the amount of glucose in your blood is too high because the body cannot use it properly. This is because your pancreas does not produce any insulin or not enough insulin to help glucose enter your body cells, or the insulin that is produced does not work properly. This graphic shows how the insulin is produced in the pancreas. Human pancreas, beta cells, glucose, and this is the insulin. Diabetes develops when glucose cannot enter the body cells to be used as fuel. This happens because either in the diabetes type 1 there is no insulin. This graphic compares the insulin as a key to unlock the door to the cells. For that reason, the diabetes type 1 is a chronic condition in which the pancreas produces little or no insulin, a hormone needed to allow sugar, glucose, to enter cells to produce energy. And the humans use energy for everything. In the other case, is diabetes type 2. In this case, the insulin, remember that we can compare the insulin with a key, is unable to unlock the door properly, or the key insulin is there but the lock doesn't work properly. What is type 1 diabetes? Normally, cells in our pancreas produce insulin. You can see it in this graphic. When the carbohydrates we eat are broken down to glucose, sugar, in our body, insulin moves the glucose into our cells. The cells need glucose to survive. But in the type 1 diabetes, an autoimmune response means the body destroys its own insulin producing cells. This means that someone with type 1 diabetes does not produce any insulin. Nobody knows exactly what caused the immune system to attack the insulin producing cells, but science tells us it's got nothing to do with diet or lifestyle. This is different to type 2, which can be caused by lifestyle or also by heredity. Because there is no insulin, glucose cannot get into the body cells and it builds up in the blood. This is the body cells and this is glucose. You can see it in this graphic. This leads to symptoms like thirst, needing to pass urine often, tiredness, and weight loss, Currently, there is no cure for people with type 1 diabetes. Injecting insulin or receiving insulin via a pump is vital to survive. But having diabetes type 1 should not stop anyone from enjoying a full and active life. What is type 2 diabetes? Stomach converts food to glucose. In this graphic you can see it. Glucose enters in the bloodstream. Pancreas produces insulin, but it is resistant to effective use. Glucose unable to enter in the body effectively, and glucose level increase for that reason. How diabetes treated? Type 1 diabetes patients are given insulin to help process sugar. However, they often have either high blood sugar or high insulin levels. Type 2 diabetes can be controlled with diet and exercise. However, many people with type 2 diabetes eventually have to take insulin injections or other drugs medication that increase insulin production. Drug treatment. For example, there is a lot of drug treatment for diabetes. An example for that is amylin mimetics, sodium glucose transporter 2 inhibitors, incretin mimetics, dipeptidyl peptidase 4 inhibitors, clinics, and also natural remedies. What is insulin? Insulin is a protein change or peptide hormone. There are 51 amino acids in an insulin molecule. It's a hormone made by the pancreas. Insulin helps keep your blood sugar level from getting too high, hyperglycemia, or too low, hypoglycemia. The cells in your body need sugar for energy, and we need energy for everything. This graphic shows how after you eat, cells in your pancreas are signaled to release insulin into the bloodstream. Type of insulin. A guide of insulin type for people with diabetes. This table shows the 4 types of insulin. The first one is the rapid acting. We can see it in the pharmacy, has a Humalog, Novolog, or Apidra. The length of time before insulin reaches the bloodstream is 10 or 30 minutes. The peak time is 30 minutes and 3 hours, and the duration, how long the insulin works for, is the 3 hours or 5 hours. The short acting, the name is like regular. We can see a lot of the short acting. The length of time before insulin reaches to the bloodstream is 30 minutes or 1 hour, and the peak time period when insulin is most effective is 2 or 5 hours, and the duration for the short acting insulin is up to 12 hours. The other type of insulin is the intermediate acting. We can see it in the pharmacies as NPH. The length of time before insulin reaches the bloodstream is 1 hour or 4 hours. The peak time period when insulin is most effective is 4 to 12 hours, and the duration, how long insulin works in the body, is up to 24 hours. The last one is the long-acting. The long-acting, we can see it in the pharmacies as a brand name Lantus or Levemir. The length of time before insulin reaches the bloodstream is almost an hour and 4 hours, and the peak time period when the insulin is most effective. This one have a minimal peak, and the duration is up to 24 hours. I need to mention these important facts. The incidence of diabetes is increasing at an alarming rate, and has been speculated that the number of diabetic patients worldwide will increase to approximately 300 million by the year 2025. The requirement for insulin will increase manifold, approximately more than 16,000 kilograms by year, and the productivity of current insulin expression system will not be sufficient to meet the future market demands. For that reason, it's very important to find another method to treat diabetes. The new treatment using stem cells. The new discovery suggests a personalized treatment approach to diabetes with the patient's own stem cells to manufacture new cells that make insulin. The new research shows that the stem cells present in the patient pancreas are able to make new beta cells. The stem cells from the patient's own adipose tissue or bone marrow can re-educate the immune system so that it no longer attacks the beta cells. The new beta cells are able to sense blood sugar levels and react accordingly. There is great interest in developing strategies to expand the population of functional B cells. Possible ways to achieve this include physical replacing the B cells mass via transplantation, increasing B cell replication, decreasing B cells death, and deriving new B cells from appropriate progenitor cells. This photo is a B cell in the pancreas. Where do stem cells come from? Stem cells for the treatment of diabetes are able to come from a variety of sources. These include fetal tissue from embryos, the placenta, umbilical cord, blood cells, teeth, bone marrow. There are a lot of important clinical challenges. As such, stem cell therapy will directly benefit persons with type 1 diabetes by replacing beta cells that are destroyed by autoimmune processes, although it will still be necessary to mitigate the autoimmune destruction of beta cells. This is a mystery that no one knows. The next stage is human trials. It's very important to mention that the new discovery was only proved in mouse and in primates, not in humans. After several more non-human primate trials confirmed this technique efficacy, the ultimate aim will be to transplant these cells into people suffering from type 1 diabetes, allowing them to produce their own insulin. This will essentially cure the disease and will render regular insulin injections a thing of the past. The necessity of new treatment is urgent. Before insulin, people with diabetes did not live very long. People with diabetes, 108 million in 1980 to 422 in 2014, who predicts diabetes will be the 7th leading cause of death in 2030. Unhealthy diets and obesity are important factors driving this dramatic rise. The conclusion: as a biology student, I recognize the necessity of a new treatment to treat diabetes. There is an alarming increase of insulin demand. We need to create another method to treat that disease. The new method uses stem cells. It's a giant discovery that the scientists are, for the first time, able to produce Human insulin produces beta cells equivalent in most every way to normally functions beta cells. This is the reference almost of all the reference from the graphics. They are of the Eli Lilly and Company catalog. This company is one of the most largest pharmacies that produce insulin. Thank you so much for your time. Have a blessed day.